Hello folks, how are you doing? Don Kelly here. Hope you're all keeping well. It's been a few weeks since my last vlog, so I'm just going to do a quick one here. Just finished working my clinic in Charleville. I'm on my way home, so I'm just going to do a quick vlog, and what I'm going to talk about here is dry needling for sports injuries and the benefits of it. Okay, so just to give you a quick tutorial on how it works and the benefits of it, and speeding up injuries, especially from sports. Alright, so essentially, like a quick run through, anyone who plays sports has got an injury. Be playing, pulled hamstring or a torn hamstring or a quad or any type of muscle injury, whatever it is, we've all got them. Okay, so the general protocol is rest it for 3 days, 72 hours, because that's when the inflammatory process continues. So the general protocol there is ice. You put an ice pack on it for 20 minutes 2-3 times a day and rest it, wrap it and bandage it up, and don't use it for 72 hours. That's the general protocol. What's actually happening in that process is when you get a muscle injury or soft tissue injury, that's the actual body trying to heal itself through an inflammatory response. So in simple terms, there's increased blood flow to the area. That's your body trying to heal the injury on its own. There's a lot of debate whether ice benefits it or delays the healing process, because when you put the ice on the injury, you're actually slowing down the blood flow to the area. So there's lots of debate whether the ice is more beneficial in the long term or in the short term. In my opinion, in the short term it's very good for pain relief. In the long term recovery of injury, it's not. But that's just my opinion. People may differ, but either way, this is what happens when you get a sports injury or get a muscle injury, soft tissue, be it muscle, ligament or tendon. This is what happens. So 72 hours, that's going on. Now after 72 hours, that process stops, so you get what's called, goes into the subacute stage. So what happens now is the inflammatory process has stopped, so the body has essentially kind of stopped healing itself. It's done it for 72 hours, and now in a strange way we're kind of in a stagnant phase. What do we do now? In my opinion, the best thing to do, now it all depends on the injury of course, and always get it medically checked, but let's just say a common strain, fairly light strain. What do we do after that? In my opinion, you get moving and using it within a pain threshold as soon as you possibly can. Okay, movement is medicine. So within the range, without causing pain or further damage, you start moving the said joint. Now, as I was saying earlier, the first 72 hours are key. That's when the blood flow, the inflammatory process is going on. Beyond 72 hours, that has stopped. Now, what has this got to do with dry needling? So if you have a sports injury and after 72 hours you have that injury, now the blood flow is stopped. To encourage further healing, dry needling encourages blood flow again. So by needling the said area of injury, you're now creating a new trauma to the injury through the needle, and that encourages the body to create an inflammatory response again. It's as simple as that. So by putting the needle in to the injured muscle, we're creating a micro injury to the area. In turn, the body will respond to that, and it encourages blood flow to the said area. That's simple terms. One of the reactions a dry needle can do to any muscle injury, and thus by doing that alone, amongst other protocols, not going to talk about them now, but I'm talking about in terms of the dry needle. By doing that, you're creating a micro trauma to the said injury, and thus encouraging blood flow to that area again. It's as simple as that. No confusion, no doesn't have to be any more scientific than that. It's essentially as simple as that. So by using a dry needle 72 hours, 3-4 days after your initial injury, it can speed up any sports injury, any soft tissue injury. It doesn't have to be sports, by the way, it can be pulled muscle, whatever. By doing that and other protocols as well that we do in the clinic, it will help speed up any muscle soft tissue injury. So that's the basic, very basic workings of how the dry needle works. Okay guys, hope that information helps. Thanks for tuning in. Any queries, please feel free to message me, and I hope you all have a great day. God bless you all and stay safe. Bye.